Bonjour et bienvenue à cette conférence de presse. Hello and welcome to this press conference. I'm Elizabeth Thompson with CBC News. With us today, we have Elizabeth May, who's Member of Parliament for Saanich Filands and co-leader of the Green Party of Canada, Tom Green, Senior Climate Policy Advisor for the David Suzuki Foundation, and Dr. Sehjal Bhargava from the Canadian Association of Physicians for the Environment, and virtually joining us is Dr. Melissa Lem, President of the Canadian Association of Physicians for the Environment, and they will be talking to us about methane emission reductions. Ms. May?
Thank you so much, and thanks to the Press Gallery for organizing this space for us. I'm honored to be here with some of the champions on the work that's going on across Canada on trying to hold the government to account on promises made to reduce greenhouse gases. The focus of this press conference is specifically methane emissions. The Government of Canada did make a commitment to cut by 75% the methane from oil and gas operations, but the recent report, which I think many journalists have made note of, from the Commissioner for Environment and Sustainable Development, Jerry DeMarco, in report number 5 of the most recent audit, found that the ability to measure methane and the Government of Canada's resources on measurement and monitoring are woefully inadequate. To speak to this, we have, I'm really honored to be here, and this is a very nonpartisan press conference, just to make that super clear. We're joined here by 3 experts, and in the following order, but I'll tell you about all of their, describe their backgrounds. So first we're going to hear from Tom Green, who is a Senior Climate Policy Advisor with the David Suzuki Foundation. Then we're going to hear from our colleague, virtually extraordinary, Dr. Melissa Lem, President of the Canadian Association of Physicians for the Environment. Then also from Canadian Associations of Physicians for the Environment, Dr. Sehjal Bhargava, and I'll add any final thoughts at that point. I'm also grateful to be joined by the Member of Parliament for Kitchener Centre, Mike Morris. So let me just start by going immediately to my left and introduce Tom Green, the Senior Climate Policy Advisor with the Suzuki Foundation, and the great focus of their work on methane.
Thank you so much, Elizabeth, and a pleasure to be here. Thank you all for coming today. My second day on the job at the David Suzuki Foundation, I went to a methane conference here in Ottawa, and that was 5 years ago. And since then, I've been involved in methane, many meetings. I've met so many methane experts, top scientists, some of them with the Environmental Defense Fund, the Clean Air Task Force, other at Carleton University, and so on. And also spoken to a lot of industry people. And one thing I've noticed is a growing will to tackle the methane problem. We have to understand methane is a very potent greenhouse gas, but it's a real opportunity because it's the one gas that if we tackle now, we get immediate benefits because it's so potent and it also comes out of the atmosphere fairly quickly. So this is a real opportunity, and we know that methane mitigation is very cost effective. The federal government has shown leadership and is moving ahead with stringent new methane regulations to meet the commitment to ensure that the oil and gas industry reduces its emissions by at least 75% by 2030. And we're very pleased with that commitment and want to see that move forward. But the recent report from the Commissioner on the Environment and Sustainable Development added more urgency to what we already know. Namely, the government doesn't actually have an accurate inventory of what methane emissions are being emitted by the oil and gas industry. Right now, it's calculated based on emission factors and estimates and industry-reported data. But when scientists go out in the field and they use their instruments and they fly over with planes and they go by with sniffer trucks and all these different techniques, what they consistently find is that Canada's inventory is greatly underestimating the amount of methane. Not only that, when we look at the sources where the inventory reports the methane, they don't map to what the scientists are finding when they go out with their instruments. So we have this data that is being used to inform the development of regulations, but the data is not tracking reality. And so there's a real missed opportunity here to dial in very effective regulations that will reduce those emissions. So there's a solution that we're all calling for, and that is actually in the mandate letter for the Minister of Natural Resources, which is that we need a global center of excellence. And this global center of excellence is to help make sure that we measure methane accurately, that the data is collected, analyzed, and is available to a range of stakeholders, industry, government regulators, so that we can tackle this problem and move forward effectively. We have to keep in mind that reducing methane emissions has climate benefits, but it also has benefits for industry. It's the most cost-effective climate action out there. And it also it will make it easier for the oil and gas emissions cap to be achieved. So I'm here on behalf of the David Suzuki Foundation saying we need to go further and faster on reducing methane emissions, and it's more than possible. So we're calling on the federal government to move forward with the center so that we have accurate measurements and data that can be used to inform future policy. So thank you.
Thank you, Tom. I'd like to go now to Dr. Lam.
Merci, bonjour à toutes et à tous. I'm joining you today from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations, or what is currently known as Vancouver here in British Columbia. And the fact that I live here as a guest on these lands and beside these waters make what we're discussing today an incredibly relevant topic for me and my patients. We know that over the next 20 years, which are a critical time for us to reduce carbon pollution and slow runaway global heating, that the atmospheric warming potential of this super pollutant methane is more than 80 times that of carbon dioxide. We also know that within BC, research shows that methane leaks from the oil and gas sector are more than double what industry and government report. We are right now coming up on the 2-year anniversary of the heat dome, the worst weather-related mass casualty event in Canadian history. I can still remember patient after patient streaming into my office with dehydration, headaches, and heat stroke, and hearing sirens in my neighborhood 24 hours a day, as over 600 people died in the space of 1 week. There are still beach access stairways and docks in my neighborhood that were destroyed during the catastrophic flooding that happened just over a year ago, and still have not seen the tens of millions of dollars that they will take to repair our local access to nature and its health benefits. I see the effects of unmeasured and therefore unregulated greenhouse gases in my backyard every single day. And the health of families who live across BC is also being directly affected by the very industries that produce and supply methane. Pipelines and plants that are part of LNG Canada, the single largest private sector investment in fossil fuels in Canada's history, are driving an increase in hydraulic fracturing for methane and natural gas in communities across Northeast BC. And research from North America shows that babies born within 2 kilometers of fracking wells have a significantly higher risk of childhood leukemia. Elders who live downwind of fracking wells in the US die sooner than those who live upwind. And Canadian research itself demonstrates higher rates of pregnancy complications in women living near fracking wells. A recent study from the US, I think many of us have heard of, linked 1 in 8 cases of childhood asthma to the indoor air pollution that gas stoves create when they burn methane. So the drive of this province, not to mention other provinces within Canada, to produce more fracked methane gas, saying that it will fit within our climate targets, is built on a faulty foundation. There's no way you can meet a climate target if that target in reality is off by more than double. And there's no way that we can have healthy families and communities if we continue to expand the industries and infrastructure that produce and use methane. So this is why CAPE is calling for an accurate Canadian methane census and data hub coordinated between governments, industry, academia, and environmental organizations, because these are essential for us to achieve our real methane targets and make us the global leaders on methane and climate change that we should be. Thanks.
Thank you, Dr. Lam. Dr. Bhargava.
Bonjour, hello. It's nice to be here today. Thank you for having us. My name is Dr. Sehjal Bhargava. I'm a public health and preventive medicine resident physician in Ottawa, originally from Saskatoon, Saskatchewan. As a physician in my very early years of training, I'm already noticing the extreme impacts that the climate crisis has on my patients' health. stress and mortality from heat waves, impacts on maternal health and pregnancy, as well as lung and cardiovascular health of people living near natural gas plants and in cities that have gas plants, as well as low air quality areas are impacts that I'm keenly aware of as a physician. Properly measuring and reducing methane emissions in line with Canada's pledges to reduce emissions is more important than ever to address immediately. Living in Ontario, I'm keenly aware that Ontario is now poised to develop its biggest increase in gas-fired power supply in more than a decade through the natural gas expansion program. The reason I'm concerned about this is that methane is the main component of natural gas with a global warming potential that is 80 times greater than CO2 or carbon dioxide. Investing in new gas plants locks us in to use them from an economic standpoint. Instead of investing in long-term fossil fuel projects, we should be looking towards renewables and other cleaner ways to generate the power that is needed to meet the demands of our population. Methane, when burned, and as mentioned by my colleagues, releases harmful pollutants such as nitrogen oxides, PM2.5, and ground-level ozone, or smog. It is a short-term pollutant, has over 80 times the climate warming impact of carbon dioxide over its first 20 years in the atmosphere, but after that can dissipate. Exposure to methane pollution is a public health issue. Promoting greenhouse gas emissions lead to more extreme weather events such as heat waves and floods and can change the infectious diseases landscapes of ticks and mosquitoes, changing our exposure to zoonotic diseases. Methane emissions have direct health impacts such as asthma in children, lung and heart diseases, stroke, dementia, hospitalizations, and premature births in women, as well as premature deaths from all-cause mortalities. All of these consequences come with very real costs to physicians in the form of more emergency room visits, hospital admissions, and missed work and school days for our patients. Methane mitigation offers a unique and high-yield opportunity to improve global air quality and can be a cost-effective component of international ozone management, which brings multiple benefits for air quality, public health, agriculture, climate, as well as energy. I'm a proud Saskatchewan girl, but stressed to know that Saskatchewan relies heavily on oil and gas production for its economic income. In fact, per the 2020 census, Saskatchewan leads Canada in terms of greenhouse gas emissions per capita. In 2020, Saskatchewan produced more than 15,500 kilotons of carbon dioxide equivalent in methane emissions. Canada as a whole produces 92,000. A saying we use in medicine and in research is that it is hard to change what we don't measure. Canada needs to follow the science we have and accurately assess methane reductions so we are able to curb them in a way that actually results in positive health impacts for Canadians. So I'm joining my colleagues here today to call for the investment in a centre of excellence to promote Canada's lead as a global centre for methane reduction and to strengthen our methane regulations so we can accurately decrease methane emissions, which will result in tangible benefits for ourselves and our patients. Thank you.
Merci. Et je veux dire quelques mots seulement pour un bref résumé. C'est clair qu'avec le rapport du commissaire de l'environnement et du développement durable, que les émissions de méthane ont été largement évaluées, et aussi que l'industrie pétrolière et gazière ont été sous-estimées de 25 à 90% du Haut-Canada. C'est inacceptable. Nous avons un cible clair pour réduire les gaz à effet de serre, particulièrement le méthane, qui était un des gaz à effet de serre très, très fort. So we know that methane emissions are a serious issue. We talk about carbon dioxide more because it has a longer lifetime in our atmosphere. Methane emissions are more powerful unit per unit. They don't stick around for a century, but we have a scandal here with a commitment to a 75% reduction in the oil and gas sector against 2012 levels to be achieved by 2030. And as of now, 2023, our estimates of how much methane is being released in the oil and gas sector is about as reliable as flipping a coin or any other random way of trying to pretend you know what's going on. You can't possibly commit as a federal government to reducing methane when you rely on industry estimates that are really entirely guesstimates. This is a very large question. The federal Liberals did promise in the platform to deliver that center of excellence on methane. It is a global problem. for sure. If anyone was looking at the news 2 days ago from Turkmenistan, there was a gigantic release of methane that, again, scientists didn't see it coming, but it was a mind-boggling amount, basically more than the entire year's worth of emissions from the UK. The oil and gas sector around the world needs to be brought in line with our goals to have human civilization survive to the end of the century. And I will stop there. All of our colleagues are available for questions. And merci tout le monde. And thank you to our moderator.
Time for questions. If anyone would like to ask a question, please raise your hand. David Thurton, CBC.
Hi, everyone. It's good to see you today. I guess the question I have is just what is a methane center of excellence? To be quite honest, it sounds like a philanthropic project that you would see at a university to honor someone. So how do you think that would work, and how would that perhaps change the problem that you're sharing with us today?
Sure. So what we need is better methane data based on actual measurements. And the idea behind this global center of excellence is to work with scientists to capture the most accurate emissions based on a range of methods, such as flying over oil and gas fields with precise instrumentation, gathering all that data, supporting it with data on the ground from mobile monitoring, and also with industry data, and putting this through proper data analytics, sorting it out, doing the analysis on it, and then reporting out numbers that everyone can use. Industry can use, because industry needs to know where its problem is. So can civil society, to call industry to account, members of parliament, but also regulators, so that they can define regulations that really help bring in the best emissions reductions at most effectively. Does that answer your question, or?
Yes, and I mean, yes, and it is a liberal. It's something in Wilkinson's mandate letter, in his platform. It's something that they've promised to do. So I'm assuming that you'll be meeting with either of the ministers, Gilbo maybe. I'm sure you're probably meeting with people in Environment and Climate Change Canada and NRCan. So what's the holdup? What are they telling you?
Well, what we need to do is to see this center funded before the next budget. We don't have time to wait that long, just given the, how quickly we need to bring down emissions by 2030. So we'd like to see a funding commitment. It is in the minister's mandate letter. We understand officials have been working on it, but there's not the urgency that we think is needed to bring this in the time required. And we have been writing to the minister. We have had meeting with federal officials. We're meeting with different MPs on Parliament Hill today to convey the importance of this.
If I can add, it certainly it was a surprise to me that it wasn't funded in this budget. There was a tremendous amount of effort from a variety of environmental groups, and there was some thought that we were getting positive signals, because it's so critical that we have the information. When you look at the report from the Commissioner for Environment and Sustainable Development, when told by the Commissioner that the failure to measure properly, the failure to act on methane required that Environment Canada and Climate Change change its methodologies, update its national inventory, the response from the department was to say, we agree. Well, you can agree, but this is going to take resources. And the alternative, of course, is to start shutting down those sections of the oil and gas sector. And I would mention fracking as one area that was also mentioned by Dr. Lem of concern, where you get fugitive emissions, but a lot of those fugitive emissions are also happening right out of production in the oil sands of producing bitumen. So you've got to get a handle on it. You've got to be able to reduce it. You can't reduce what you're not measuring, and you can't possibly hit a target of reducing by 75% if your means of measurement are completely imaginary. This has to be a serious effort of funding the science and the monitoring, and not relying on industry data alone. You need to, we used to say in arms control, trust but verify. Well, we don't have any way to verify.
Any other questions? And nobody online? Thank you very much.
Thanks to Dr. Lim for making the effort. I wish you were here in person, but thank you.
Thanks. Another time. Take care, everyone.